Hi, Miss Green. My name's Stephanie Guy. I'm your nurse today. Can you go on and verify your name and your date of birth for me? Let me verify. Very good. Okay, Dr. Williams has ordered for you to have a nasogastric tube inserted today. It's just a flexible tube that will pass down your nose into your stomach. It should help with this nausea and vomiting that you're experiencing. And it's another way that we could give you your medicine so that you can take it more easily. Is there any questions before we get started? And do you have any allergies? All right, let me gather up my supplies and we'll get started. Ms. Green, for this procedure, I need a towel, a couple washcloths, a cup of water, a 60 cc syringe, emesis basin, gloves, the nasogastric tube, a roll of tape, pin and rubber band, water-soluble lubricant, and a couple of alcohol wipes. So that's the equipment I'll be using with you today. All right, I'm going to go on and wash my hands before we get started and tear the tape that we're going to use for this procedure. Tape just does not want to tear well when one's wearing gloves. I'm going to attach the tape to a washcloth. I do want to tear one strip about 6 to 7 inches long. And tear it down the center. Attach it to my washcloth. Tear the other piece of tape about 6 to 7 inches long. Tear it down the center, but stop about 1 inch before the end to where it resembles a pair of pants. My other piece of tape is going to be just real tiny so we can mark our tube. All right, before I get started, I would like to go on and measure this tape. I'm going to measure from the tip of your nose to your earlobe and then down to your xiphoid process, which is down here. Cross over, measure down. And now to remember where this side is, I want to go on and mark it with this little piece of tape. All right, let's put this towel over you. I'm going to go in and raise your head on up as high as I can get it. Do you have any trouble breathing out of your nose? If you did, I'd insert this in the area that you could not breathe out of. Before we get started, I'm going to go on and clean your nose. Let me put these gloves on. I'm going to clean your nose with an alcohol wipe just to take care of any oils you might have on your nose that'll prevent the tape from sticking properly. Let me cover your eyes with this washcloth so these fumes will not irritate you. Very good. Now I'm going to tip your head towards me a little bit more. I'm going to give you the emesis basin, and I'm going to give you this cup of water. As I'm inserting this, at one point I'm going to ask you to start swallowing the water, and it'll help the tube go on down. Do you have any questions? Okay, let's get started. Let's lubricate this tube. I'll start inserting this tube now. If you feel nauseous, grab up your emesis basin and I'll slow down. Tip your head forward for me. Continue to swallow, 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 and I'm at my mark. Very good. Now I'm going to hold this in place and tape it in place. All right, now I'm going to check placement of the tube to make sure we're in your stomach. I'm going to check placement by listening and by inserting some air into your stomach. I'm going to pull up 30 cc's of air in my syringe, attach it to the tubing, place my stethoscope over the abdomen, hold it tightly against the skin, and push the air in quickly. I should hear a swooshing noise. Now I'm going to aspirate. Pull back on the tube. And you should see stomach contents entering the tube if it's in place. And they are. I'm going to push the stomach contents back in. Now we're going to take and put permanent tape on the tube so that it will not become dislodged while you're moving around in bed.
Go ahead.
All right, the permanent tape is the tape that looks like a pair of pants. I'll attach the end of the tape to your nose. Then we're going to take this tape. I'll hold one piece to the side, hold the tube, and I'm going to start twirling the tape in a downward fashion. I like to take the tape and to press it firmly against the tube so that it adheres nicely and it just looks better. Now I'll take my other piece of tape and go across the bridge of the nose over this tape to secure it even more. This is long, so I'll go on and tear it. Now, we've just inserted your NG tube. X-ray will need to come and confirm placement of this tubing for you. That's the most accurate way of confirming placement. And until they get here, I'm going to go on and pin this to your gown so that it won't be in the way of your movement in bed. Just simply take the pin, put the rubber band around the tubing, pass the pin through, and I'll pin it to your gown. Okay, Ms. Green, we've got this tube inserted now. X-ray will come to verify placement later on. Before I give you anything in your tube, I do want to verify placement. I'm going to do that by listening with my stethoscope. I'm also going to aspirate or pull out some of the fluids from your stomach to make sure that's in placement. Then I'll give you your medications or feedings that's ordered. After I give you any medications or feeding, I'm always going to give you some water by pulling it up into the tube. Pull up about 30 to 60 cc's and pushing it into the tube. That will keep your tube patent. Do you have any questions? Very good. I hope you feel better.